Thank you very much. Thank you for inviting us here. We are very excited because all the wonderful research we hear for the last 2 days, we implement in clinic to take care of our patients. So we're very happy to be here. I'm Violetta Renesca, and I introduce, this is our agenda. So I'm going to tell you a little bit about who we are. Then we just touch in on ME/CFS. Then we're going to present some cases and treatment approach, and then summarize everything. So our Institute for Neuro-Immune Medicine is part of Nova Southeastern University, NSU Health. We are located in Florida. We have 2 locations, in Davie and Kendall. We have 7 providers with over 150 years of combined experience. And our providers are certified in have different certifications. We have over 3,000 patients from 42 states in the United States and many from abroad. We believe our patients, we believe that chronic fatigue is real, and we're trying to do the best to provide care for them. Currently, over the years, there were many different case definitions for ME/CFS. Currently, we're following the Institute of Medicine 2015 case definition. As you guys all know, chronic fatigue syndrome has multiple symptoms and multiple causes. Most of our patients would say that they have post-infectious onset of the illness. However, we have people with profound stress or toxic exposure that was the beginning of their symptoms. The problem with the treatment is there is a heterogeneity of symptoms, disease progression, response to treatment. So it's hard to treat this patient because what works for one patient not necessarily works for another. So when we see new patients, we're trying very hard to find something that we can treat, treatable cause of fatigue. Fatigue is the most common symptoms in many illnesses. So if we can find it and address it properly, then the symptoms can resolve. Oops. Our approach is personalized thyroid intervention. We're trying to account for patients' genetic, environmental exposure, lifestyle, and other factors. We look at the patients from immune system approach. Immune system is involved in disease processes, in recovery, capacity to resistance. Complex illnesses like chronic fatigue has inflammatory response and autoimmune reactions. So understanding immune system can help us understand the disease better. There is an interplay between genetic predisposition and environmental factor, and both of them can affect the immune system. And finally, immune system can be a biomarker or can help us to follow the disease progression. Immune system is all about balance. Healthy immune system protect us from infections, help us to recover. However, inappropriate response can disrupt the whole function and cause host cell damage. When immune system make a mistake and start attacking our own tissue, then we call it autoimmunity. When we have exaggerated response that leads to inflammation and tissue damage, you can have allergies, asthma, and so forth. And inadequate response can lead to chronic infection burden. So when we talk of chronic fatigue and when we treat chronic fatigue, we have to address energy, mitochondria function, and nutrition. We have exercise physiologist on the staff, and he does submaximal exercise testing, and then he provides personalized approach to the patients. Sometimes exercise, sometimes just activity of daily living is considered exercise for the patients. We often use nutritionists to look at the patient diet. We prescribe therapeutic food plans. We test for mitochondria function, energy, metabolism, micro and macronutrients. So muscle biopsy is the gold standard of mitochondria function, but there are some non-invasive tests, and this is example of one of our patients that this non-invasive test that was abnormal, and the maker of this test say that there is a correlation about 80% to muscle biopsy. So that can be used as a non-invasive, easier for patients to test that can be done. There is many metabolic abnormalities in patients with chronic fatigue, and that pertains to mitochondria. And this is example of one of our patients. When we look at the deeper dive in their nutritional status, we see markers of oxidative stress, problem with mitochondria, elevated inflammatory markers, toxic exposure, and so on. So sometimes shortage of nutrition can affect how the cell works. The nutritional deficiencies can occur because of increased utilization, problem with digestion and absorption, of just decreased dietary intake. This can be a problem because patients sometimes they don't have finances, sometimes they don't have energy to get proper nutrition, so they get something that is easy to prepare. So this is another study that showed there is a problem with metabolism of fatty acids, glucose, amino acids with patients with chronic fatigue. And this is the result of our another patient. The schematic shows Krebs cycle. This is how the cells produce energy. And this patient has, if you look all along, all these yellow and red circles, so she has buildup of lactic acid and other metabolites and elevated marker of oxidative stress that show that this process is not going the way it should. So in research, there are different proposed mechanisms why mitochondria doesn't work: structural changes, increased demand, lower reserve, problem with oxidative phosphorylation or ATP synthesis, and then compensatory anaerobic glycolysis when the patient produces energy without the oxygen, which is not a very effective way to produce energy. So intervention, it's a lifestyle and supplements. As I said, plan exercise, caloric restriction, food plans that can maybe support mitochondria function, sleep, macronutrients, and also supplements in combination and together, like CoQ10, alpha-lipolic acid, carnitine, D-ribose, oxaloacetylate, NAD in different forms. Metabolisms also drive cellular function. And you guys hear all from Dr. Hanson right before, early in the morning. But so this is one of the articles from her group, which shows that immune system to work requires energy. When a resting cell of the immune system has lower energy demands, however, activated immune system crank up production of energy to mount the immune response. So if the cells are not able to produce energy effectively, the immune response will not be sufficient. And there is a problem with immunometabolism in MECF patients through three different proposed mechanisms: energy, exhaustion, and senescence. Energy when the immune system is not able to mount the response. Exhaustion, that's prolonged exposure to antigen, and the cell just get tired. And senescence, this is normal cell death that is get affected, and then there's inhibition of apoptosis, and that leads to release of inflammatory signals. So when we look at so this is result of one of our patients. When we look at the immune system, we see the B cells, T cell abnormalities. We also see NK cell abnormalities, natural killer cells, a cell of the immune system that are responsible for fighting viruses and cancer. And in majority of our patients, natural killer cell cytotoxic function is low. We also see chronic inflammation, low-grade inflammation, and activation of the immune system. So we're working very hard to improve the immune function because we feel even if the patient's symptoms don't improve, if we improve the immune function, that's the first step towards the right direction. Because as I said earlier, the immune system is not only is involved in recovery and repair. So lifestyle modification, stress management, sleep, smoking cessation, healthy diet, some supplements. There is not many medication that we can use, prescription medication, pharmaceuticals. So we kind of use supplements, inosine, mushroom extracts, probiotics, low-dose naltrexone, garlic, vitamins. We see also patients with, on different spectrum with immunodeficiency where they are not able to produce antibodies. And sometimes patients with chronic fatigue develop primary immunodeficiency. And in the right upper corner, we have results of the patient that was a carrier of the gene for common variable immunodeficiency. And after many years of diagnosis with chronic fatigue, she was found to have deficiency in immunoglobulin, and she was placed on immunoglobulin infusions. Of course, we address infections. I'm not going to spend too much time about it because I think this is very well topic cover, but this is not all-inclusive list of pathogens that we look for, but we look for pathogens. We do different testing, antibody testing, DNA analysis, antigen-specific T cells, and in the research we also use next-generation sequences when we're trying to find pathogens that are not we're not able to find through commercial labs. And the treatments, it's pretty much pathogen-specific treatments, antivirals, antibacterial, antifungals, immunomodulation, improving the immune function so the immune system can take care of the pathogen itself, or sometimes immunoglobulins.